What I wish I knew about doctor's bills before my first solo checkup. Honestly, it would have saved me a lot of confusion, stress, and maybe even a few dollars. If you've ever found yourself sitting in a waiting room, nervously filling out forms and wondering what's going to happen when the bill arrives, you're not alone. The world of medical billing can seem like a maze, full of strange codes, mysterious charges, and a lot of paperwork. But understanding how it all works can make your healthcare experience a lot less intimidating, and maybe even empower you to ask the right questions and avoid surprises. It's not just about the doctor or the medicine, but a whole behind-the-scenes process called medical billing. While you're focused on your health, there's a team of people working to make sure the financial side of your visit is handled correctly. This process is what keeps clinics running, doctors paid, and patients informed about what they owe. It's a system that connects your care to your insurance, and ultimately, to your wallet. But what exactly happens after you see the doctor? Let's break it down step by step. So, you visit your doctor for a checkup. The doctor does their thing, maybe checks your throat, prescribes something, and you're on your way. But while you're thinking about your health, the clinic is already thinking about how to document your visit. Every detail matters: what symptoms you described, what tests were ordered, what treatments were given, and what advice was shared. All of this information gets carefully recorded in your medical chart, either on paper or, more often these days, in a digital system called an electronic health record, or EHR. This record is the foundation for everything that comes next in the billing process. But what happens next financially? That's where medical billing jumps in. The moment your visit is over, a whole new process begins behind the scenes. The clinic's billing team takes the information from your medical record and starts translating it into the language of insurance companies. This isn't just about making sure the doctor gets paid, it's about making sure the right services are billed to the right payer, whether that's your insurance company, a government program like Medicare or Medicaid, or you, the patient. The accuracy of this process is crucial because even a small mistake can lead to denied claims, delayed payments, or unexpected bills. Think of it like a translator between your doctor and your insurance company. After your visit, the clinic writes down what was done and turns it into special codes. These codes are the universal language of healthcare billing, allowing doctors, clinics, hospitals, and insurance companies to communicate clearly and efficiently. Without these codes, it would be nearly impossible to process the millions of healthcare claims that happen every day. The billing team's job is to make sure every service, test, and procedure is coded correctly, so your insurance company knows exactly what happened during your visit. These aren't secret codes, just standardized ones called CPT, ICD-10, and HCPCS. CPT codes describe the medical procedures and services you received, like a physical exam or a blood test. ICD-10 codes explain your diagnosis, such as strep throat or high blood pressure. HCPCS codes are used for things like medical equipment or certain medications. Each code is like a shorthand that tells your insurance company exactly what happened during your visit. Learning about these codes can help you understand your bill and even spot mistakes if something doesn't look right. Next, a biller uses those codes to create a claim and sends it off to your insurance company. This claim is like a detailed invoice, listing every service you received, the codes that describe them, and the charges for each one. In the past, these claims were often mailed or faxed, but today, most are sent electronically through secure online systems. This speeds up the process and reduces the chance of errors. Once the claim is submitted, the waiting game begins. The insurance company has to review everything and decide what they'll pay for based on your specific plan. The insurance company reviews the claim, checks what your plan covers, and decides how much to pay. This is where things can get complicated. Every insurance plan is different, with its own rules about what's covered, what's not, and how much you have to pay out of pocket. The insurance company looks at the codes, compares them to your policy, and decides whether to approve the claim, deny it, or ask for more information. Sometimes they'll pay the full amount. Other times they'll only pay part of it, or deny it altogether if they think something wasn't covered. This is why it's so important to know what your insurance plan covers before you go to the doctor. If insurance pays for everything, yay! That's the best case scenario. You might get a statement in the mail called an explanation of benefits, or EOB, showing what was billed, what insurance paid, and what you owe, if anything. Sometimes you won't owe anything at all. especially if you've already met your deductible or if your plan covers preventive care at 100%. It's a great feeling to know your insurance has your back, and you can focus on getting better instead of worrying about bills. If not, the clinic sends you a bill for whatever's left, like co-pays or deductibles. This is where many people get confused or frustrated. Your bill might include charges for things your insurance didn't cover, or amounts you have to pay before your insurance kicks in. It's important to read your bill carefully and compare it to your EOB. If something doesn't make sense, don't be afraid to call the clinic or your insurance company and ask questions. Sometimes mistakes happen, and you have the right to understand every charge on your bill. And if something gets stuck, someone at the clinic chases it down, calling the insurance company to ask, "Hey, where's the money?" This part of the process is called claims follow-up or claims resolution. Billing staff spend a lot of time tracking down payments, fixing errors, and appealing denied claims. They might have to send more information, correct a code, or explain why a service was necessary. It can be a long and frustrating process, but it's all about making sure the clinic gets paid and you don't get stuck with a bill you shouldn't have to pay. If you ever get a bill you don't understand, remember that there are people whose job is to help you figure it out. So next time you get that bill, remember, medical billing is just the way everyone makes sure the right people get paid. It's a complex system, but it's designed to keep healthcare running smoothly. If you ever feel overwhelmed, take a deep breath and remember that you have options. You can ask for an itemized bill, request a payment plan, or even appeal a denied claim. The more you know about how medical billing works, the more confident you'll feel navigating the system. And if you ever need help, don't hesitate to reach out to your clinic's billing department. They're there to help you, not just collect money. Now that's one less mystery at the doctor's office. By understanding the basics of medical billing, you can take control of your healthcare experience, avoid surprises, and make sure you're only paying what you truly owe. Remember, knowledge is power, especially when it comes to your health and your wallet. So the next time you visit the doctor, you'll know exactly what's happening behind the scenes, and you'll be ready to tackle any bill that comes your way with confidence.